It's 3 a.m. in the morning. Your little one has been a bit niggly. They've been crying, not sleeping, and now they've just spiked a fever. What do? Do you give them some Panadol and hope for the best? Do you rush them to emergency department? Or do you just wait it out and see what happens and maybe get in with your GP the next day? Welcome to our weekly live of Mother, Doctor, Nurse, where we cover the common childhood concerns that you as parents and caregivers have. My name is Dr. Deb Levy. I'm a holistic pediatrician and mum to 2 young girls. And joining me as always is the wonderful Sarah Hunstead of @CPR Kids, your go-to place for baby and children's CPR and first aid courses. So thank you, Sarah. And as always, we're going to have fun today.
Oh, we will, absolutely, because, I've been there in the middle of the night not knowing what to do. So,
Yep.
Deb, you've said it's midnight. We don't know what to do. Our child's got a fever. So tell us, what do we do? What's the magic answer, Deb?
Do you know what? I'm going to give one of those annoying answers and say, it depends.
I knew you were going to say that.
And it depends on a whole lot of things. Well, what I'm going to tell you what not to do is go onto Dr. Google. Because although you may find your way to some very credible resources and advice, you can get lost in the whole internet craziness rabbit hole. So it's never my recommendation to go and randomly search things. So I guess, when I say it depends on 2 main things. 1, the age of your child, and 2, the state of your child. So we can break that down a little bit further, and interrupt me anywhere along the way, Sarah. And obviously what I meant to also say in the beginning is I'm very happy to answer any questions. Obviously I can't answer specific personalized questions. And, this is for anyone who's watching this live. And just type that in the comments and we'll get to that as we go.
We will.
So back to, the age of your child. The general rule is the younger the child, the more cautious we are, so the quicker we intervene, the quicker we get their medical attention. And take, for example, a fever, which is, the scenario that I described initially. And, we talk about a baby under the age of 1 month needing, with any kind of a fever, needing urgent review. Some would push that to under 3 months. And I certainly do agree with that, but your baby may not warrant, as much intervention as if they were under 1 month. So, and I guess the big, and I really feel like I'm going down a bit of a rabbit hole here, is, around, well, do I need to rush them to hospital? So, certainly a young baby under 1 month, if not under 3 months, if they have a high fever in the middle of the night, I think it's a good idea to get them reviewed sooner rather than later. I don't know if you agree with that, Sarah?
No, absolutely. And I think as well that it can be that particularly when, you're a new parent, you haven't been through this before, I think it really is good to draw a line in the sand with that. Because a lot of the hospital and guidelines are that it is simply that under the age of 3 months, if they have a temperature over 38 degrees, that it is important to go and get them reviewed. And of course, there's lots of red flags, and we've done videos on the red flags. We've done videos on fever. So we want you to go and extend on this information that we're giving you today and go and watch that as well. That's really, really important. So if your baby is under the age of 3 months, it is really, really important to get urgent medical review. And I agree, Deb, in the middle of the night, especially if they're doing all those things such as, they're not feeding well, they've, especially if they've got breathing problems, anything like that, which are the red flags, which I'm sure you're going to go through at some stage, you do need to take them to your nearest hospital.
Yeah. So why don't we just jump into some of those red flags now? So we've kind of touched on the age of your child. The next part is the state of your child. So here what we're talking about is how sick are they?
Yes.
And are there any specific signs that makes me and Sarah and any other clinical healthcare providers go, oh my goodness, we need to be a bit more concerned. So in terms of the state of your child, Sarah's already mentioned the term red flags. And what do red flags really mean? These are signs and symptoms that we look for that can indicate that your child is more unwell. And there are many of them, but I think if we kind of just look at it, basically, we're looking at the general state of your child. So here we're talking about, is your child otherwise happy? Sitting there, yes, they've got a bit of a fever, they're crying for a bit, but then they'll stop, they'll play with their toy, and then they'll carry on, or on the other end of the extreme, are they totally flat? Are they floppy? Are they lethargic? Then you can also get a child who's very irritable. And this is a child who you're unable to settle. And that is one that can be a little bit hard to determine in the middle of the night if your child is also tired and should be sleeping. But I always think, and we're going to keep on coming back to this, I'm trying not to mention it too many times, but as a parent or caregiver, if you are worried about a child in the middle of the night, rather seek medical attention straight away. Even if it's a case of everything's fine, don't worry, and you're reassured, rather have that than sit at home, either with a child who could potentially deteriorate, or you're sitting at home with a whole lot of stress, and it's just not worth it.
Yep, exactly.
So, and then in terms of other red flags, it all depends on, how long your child has been unwell for as well. We look at the signs of dehydration. That's another big one. But also in terms of their respiratory effort, do you want me to go through everything again, Sarah? I feel like we've spoken about it a bit in the past.
I think we can summarize it really quickly, though. I think that, because what we do want everybody to do is go and watch our video on red flags and fever and so on. But I think we can quickly summarize it now.
Sure.
So I love what you've said so far in the fact that we're looking for a child who is either really irritable, they can't be consoled, or they're really flat. You may have the, difficulty rousing them. They're more lethargic or drowsy than usual. And the fact that we've got to trust our gut. Also that you've talked about breathing problems. So if they're having any difficulty breathing, they need to have urgent medical review. So what else is there on the list? You talked about dehydration, so less wet nappies than usual. They're not drinking as much as usual. So we generally say less than half their normal feeds and half their, wet nappies. But what else is on the list, Deb?
So breathing difficulties, which we've already mentioned, I think it's not just how hard they're working with their breathing. And then you can really see, child working really hard. Maybe their shoulders are going up and down. They're sucking in under their rib cage, sucking in at the base of their throat. The base of their neck. Those are the signs we look for, or any abnormal noises that they're making when they're breathing, I would be more concerned about. So the two typical noises that we listen for in children are either a noise when they breathe in, which is typically called stridor, which can happen with something like croup. And I will imitate that now. It's like a it's like a high pitched, that noise. I'll do it again. That noise, that stridor. Or you've got your expiratory noise, so when children are breathing out, and that we will typically call a wheeze, and that's a slightly different. Listen, I'm just trying to imitate. And again, sorry, that's my dog. Again, these sounds can be a little bit interchanged. You can have stridor in and out. You can have, biphasic wheeze as well. So I mean, it's not an exact thing, but just to give you a little bit of an idea.
Yep.
The other big thing that we look for is, and I'm saying look for business, I also want to talk a little about the skin.
Please do.
And skin color as well as skin rashes. So skin color, if your child has got any discoloration around their mouth, inside their mouth, and by discoloration, I mean any signs being purple, being blue, that is certainly a sign to be worried about urgently, and that would be something requiring hospital, if not ambulance intervention, actually. And so any change in color, the other change in color I'm referring to is you'll often see children when they have high fevers, they'll get, especially on their periphery, so their hands and feet, and maybe even their legs and arms, they can get very pale and white and quite cool to the touch as well. So that's also something that would make me a little bit more suspicious that something could be going on. These are not red flags, by the way. These are just things that we often look for.
Yeah. An important thing that as well is no matter what color skin your child has, whether your child has light colored skin or dark
Mm-hmm.
skin, what you're looking for is
There's a
something
change.
that is different to normal. So that
Exactly.
change. So if your child has very, very dark skin, what you may be noticing is that it's around on the inside, their
Mm-hmm.
lips, on the
Yeah.
inside of their gums, that it's, around here that you're noticing. If your child has very light skin, you may notice, as Deb was saying, that they may become marbled and splotchy. So it's just looking to see what's different to normal. And that's something that, when you do seek the medical help, that you can explain to the doctor who doesn't know your child, but you know your child, and you can tell them that they're not normally like that. And that's the important part.
Absolutely. And then the other big thing is rashes. We spend a lot of time talking about the difference between blanching and non-blanching. So what is the difference? Essentially, it's all about whether or not the rash goes away or decreases when you put pressure on it. So the one we worry about is the one where if you put pressure over it, even just with your finger, that you can just rub your finger over the surface of it, or you can use a glass, a drinking glass, which is quite a classic way to. If when you put pressure on it, the rash does not change, that is a more concerning rash. That's what we call a non-blanching rash. And what we worry about with that is that it's not just a typical rash, which is usually associated with viral infections and other things. But what we worry about is that that could indicate that there's bleeding there underneath the skin, which can be a sign of many things, including septicemia. And septicemia is essentially a serious infection of the whole system, but through the bloodstream as well. And, you hear things like meningococcal, pneumococcal, illnesses which can actually cause this. And I guess that's the classic picture where parents will often think of a rash as with a meningitis from like meningococcal or pneumococcal, where children will develop these quite frightening looking rashes. They look different from a normal like pale pink rash that, as I said, will go away. They do look, darker, and they, once you've seen one, you recognize them quite quickly, Sarah. Wouldn't you agree? I mean, we've both obviously seen them in
Absolutely.
clinical practice.
Yes. And I think one of the important things too is I'd love you to go and watch the videos that we've done with the Queensland Paediatric Sepsis Program that talks about all the signs and symptoms of sepsis, and certainly the signs to look out for, because, definitely that rash is one of the signs, but it's certainly not the only one. And so being equipped with the knowledge to know what to look out for is so important. So please go to the YouTube channel or the CPR Kids Facebook page and have a look at those videos with the Queensland Paediatric Sepsis Program that really do thoroughly go into what those signs and symptoms are. And there's some great resources there too from the Queensland Paediatric Sepsis Program specifically for families, which is great. Oh, sorry. Everything just froze then, Deb.
Yeah,
but we're good now.
It's
back. Yep.
There you
all
go.
Good. We're back again. So, Deb,
I've got a bit of a lag from you, though.
Ah, dear. Oh, the interwebs. I tell you what, they cause nothing but troubles, really. Anyway, as I was saying, Deb, is there anything else with the red flags that you'd like to talk about? You've talked about color changes. You've talked about your child's behavior, so whether they're irritable or flat. We've talked about their hydration status. So are they dehydrated? They've got less wet nappies. Are they taking in less fluids than usual? We've talked about how they're breathing. If they've got strange breathing noises, are they working with their muscles to help them breathe? So we've looked at that. We've talked about rashes as well on the skin and the worrying rashes. Are there any other red flags that you want to talk about, or should we go on to the next part?
Look, I think the other important thing to be aware of are the specific symptoms that are a little bit more worrying. So I guess this also leads into the next part is, and again, just thinking about meningitis, we worry about a child who has severe symptoms, and that's a severe headache, a severe abdominal pain. The extremes of symptoms are obviously always more worrying. Vomiting that doesn't start decreasing, so those are, we're talking about symptoms that are above and beyond what you would see with like a normal illness, 1 or 2 vomits, they feel better, a bit of a headache that they drink a glass of water and they feel better, so we're talking about those extreme symptoms. And I think that although, when we talk about the classic red flags, that's more like around breathing and general state, etc. I certainly think that these more significant symptoms, we do need to be aware of them. And that all being said, I do think that as a mum myself, you do have that instinct to know, like, this is out of the norm. This isn't quite right here, and this isn't sitting comfortably with me. So, again, it's about trusting in yourself, and also, and also the system, and I think it's a difficult space to be in. Obviously, Sarah, you and I come from a little bit a different world where
we do.
We are perhaps more confident to advocate if we don't feel that our child or our concerns have been taken seriously. But I do want families to always feel confident that if they are not happy and they don't feel that their concerns are being heard, push ahead, ask someone else, keep asking, keep presenting, because ultimately, it is about, we have to advocate for our own children. And
we do. Yeah, we absolutely do. And yes, without a doubt. And it's interesting you talk about this, because we sent out a blog post yesterday all about ways to advocate for your children. And I think that's a really important thing. And you highlighted something that I think we don't talk about enough. And that's pain in children. That pain that is not relieved by simple analgesia is really concerning. It really, really is. And sometimes it can be hard to gauge in little ones, but that's something we really want you to tell your doctor about and seek medical help, because it's not normal for kids to be in pain. It's not.
No. And you can always give pain relief. So don't ever think that it's going to impact on our assessment of your child. Please always give pain relief.
Yep. Absolutely. Most definitely. And exactly. You're not masking anything. Children shouldn't be in pain. Now, so we've talked about some general stuff, Deb, but what about, is there anything weird and wonderful, or perhaps not as talked about, that we need to seek urgent help for? One that perhaps parents and carers would be going, oh, I didn't know that. Is there anything?
Well, there's always the story of the hair tourniquet. And I know that that's something that you would deal with more, because usually that would be managed, by triage before they come through to the actual emergency. And well, what's a hair tourniquet? And who does it happen in? It happens in very young children, who often don't have the ability to communicate exactly where their pain is coming from. And what is it? It's when, a piece of hair gets wrapped around an appendage, whether it's a toe, a finger, a penis, anything that's small enough for a little hair to wrap around. And what it does is it wraps around a couple of times, you don't notice it. And it then decreases, if you think of when you put anything tight around you, it changes the blood supply. And then the end gets very swollen, very engorged, and very painful. It's so easy to remedy if you know to look for it. And no doubt Sarah has cured many, many children of this very painful condition.
Oh, it was one of the favorite things to do back in emergency, I tell you that.
Hair remover cream, right? Isn't that what you
hair remover cream? That's exactly right. But what we do encourage you to do is that even if you are using the hair remover cream to be able to dissolve the hair, often what we've seen is that parents have done that, but it hasn't been relieved, that it's so under the folds of the skin. You really do need to still get them checked out. So please don't just use that, because we really need to be getting, the big, I've got a mental blank, magnifying glass equipment out and really getting in there.
The thing that makes things look big. Yeah, Sarah.
Yeah, things that make things look big. That's exactly right. To really look in there and make sure that has been fully removed. And that's a really important thing. So we've talked about those, but what else, Deb? What about some boy bits? What about testicles?
Yes. What's in a medical emergency? Is that what you're asking me? So, painful red testes. That's it. That's all I need to say.
Full stop.
So, or with testes, and then we can talk about other boy bits. So what we're worried about there is essentially what we call testicular torsion, where the testicle literally just torts in on the cord that it sits off. And that is an emergency. You know, don't pass, you know, what do you go past go? Don't collect your 200, just go straight to hospital. And the reason being is that if that remains twisted, it impacts the blood supply and that testicle can die. The other thing that boys get is, other than the hair tourniquet potentially, is they can have problems with their foreskin. So these are children who are uncircumcised. If the foreskin retracts and gets stuck, that's another medical emergency. So that's something called, in terms of go to the hospital, and that's something called paraphimosis, where, again, exactly the same concept, except the skin causes the tat occlusion, the end gets swollen and gorged and very painful. This usually happens in boys who are a bit older. And it can be quite embarrassing for them. So be aware, if you've got a child, you know, who's a little bit older, just make sure that you've kind of encouraged them to share all of their concerns with you.
Yeah, absolutely. Yeah, have them feel safe enough to come and talk to you if anything is to happen about that. I think that's really
and to have the right language. Yeah.
Exactly. That's exactly right. And one of the other things that I think that sometimes, you know, parents and carers might not think about that needs medical help is foreign bodies in ears as well. I've seen lots of kids come into emergency who have stuck things deep inside their ear canal, and, you know, grandma or someone, not, you know, pointing the finger at grandmas, but it just happens that that's my experience, have gotten in the tweezers and tried to dig them into the ear, and a whole lot of trauma has happened. So, Deb, do you want to expand on that a little bit about how important that is to leave it for the doctor?
No, I mean, I think that you've covered it exactly. I mean, it's very tempting, right, to try and get something out, especially if you can see it.
Yes.
But unless you've got the proper equipment, and honestly, I've tried to get many things out of ears, and sometimes it's really, really tough, no matter what equipment we've got. And sometimes we end up having to go to theatre for it. So, so that's going to surgery for it. But yep, I agree. Anything lodged in an ear, any foreign bodies really, but I guess the whole question comes to, well, how urgent is it, and you know, do you need to rush to the hospital? So a lot of foreign bodies stuck in orifices can actually be dealt with at your local doctor.
Yes.
You know, so if you're in doubt, and it's usually something that happens during regular hours anyway, you know, because it's, you know, your child's not normally in bed with funny things. So I would either give your own GP a call to be guided by them, or I know that Sarah has some wonderful resources that she's going to share with us in terms of where you can get some guidance.
Yep, absolutely. And I think one of the first one that comes to mind is, of course, there are lots of fact sheets from the Children's Hospital. So both Queensland, New South Wales, the ones in Victoria, there's lots of fact sheets there. So going straight to the hospital websites are always good. Another thing that you can do is Health Direct has a symptom checker. So you start with entering your child's age and so on. And so you enter the symptoms that they have. There's everything in there from breathing problems to burns to all sorts of things. You enter their symptoms and it will guide you as to any first aid that needs to be done at home, and also then where to seek medical help, whether that's urgent, whether it's an ambulance, whether it's making an appointment with your GP. And that's all in every state online. It's accessible everywhere. Then there's also the telephone advice lines. Now, there's the Health Direct in states. There's also 13 Health in Queensland. There's Nurse on Call in Victoria. And the idea is you're actually speaking to a clinical nurse who will guide you through what you need to do after going through the symptoms of what your child has, and they can advise you where you need to go. So that's an important thing. There are also after hours telehealth consults that you can do. So a short Google of after hours doctors in your area is important. There are lots of ones around. There's even pediatric specific ones. So for example, there's Cub Care, who are pediatricians well, they're not pediatricians, sorry, they're pediatric emergency physicians who are after hours for urgent things. So there's lots and lots of resources out there. But what I'd encourage you to do is next time you're going to your GP or your pediatrician, ask them what their clinic has for after hours as well, because a lot of them have affiliations with doctor home visits and so on. And one question that we're getting all the time at the moment is, I can't get into my GP because they're not seeing kids with fevers or respiratory problems. So what's popping up a lot at the moment, particularly in Queensland, in New South Wales and Victoria as well, are respiratory clinics. So what I encourage you to do is speak to your GP. This is being rolled out quite extensively at the moment around New South Wales as well. So there's potentially respiratory clinics to take your child to, and there's the option of telehealth as well. So, certainly, Deb, I know you're doing telehealth at the moment for your patients, as well as seeing them face to face, which is just fantastic. It's such a good resource to be able to have. But we understand that for things that, are more urgent like that, please work out what is your GP offering. So know before it happens, so you know what to, where you can go. Okay. So it's a really good conversation to have before your child gets sick. Now, Deb, is there any other resources that you wanted to add to that list at all?
No, I don't think I've got anything else to add. Yeah.
Okay, excellent. Well, we're going to follow on this conversation next week. What we're going to do is talk about, you've taken your child to the doctor. You might know what they've got. Might be a viral infection, could be gastro, could, whatever they've got. But when can you actually send them back to school or daycare? That is the $1 million question, isn't it? So next week, that is what we're going to be talking about. And we will see you all then, same time and same place. And remember, you can watch the recording anytime. So thanks so much for watching, everyone.
Thanks, everyone. Bye.